Hi, everybody. This is Ena Koellish with Realty World Knox Realty Group, and I am with
Ann, and I am a nurse practitioner, and I own NuVital Infusion and Wellness.
Okay. So we are here today because we want to talk about health, wealth, and
Wellbeing. I think we have, topics that we've talked together about amongst ourselves and thought it might be beneficial to, put it out there.
absolutely. Ann here is not only my neighbor, but she's also a dear friend. And although we are very different from each other, we do well together, I think.
Yeah, opposites attract, right?
Yeah. And one of the things we do have in common is that we want the best for folk out there. For me, particularly women, but we're not excluding men. However, I do think that we have a lot to talk about, a lot to share with you. We love the community that we are in. We've established roots here. We're both military spouses. Talk about that.
Yeah, so I was raised military, I was military, I married military. So been all across this great nation and outside of this country as well.
Right.
And those who are not in that type of lifestyle, I think they don't know how much we have to adapt and change, right? As we move from place to place and kind of develop a whole new friend network, and it's been great to be here and kind of settle down a little bit and really dig into the community. So I feel that that's been a difference in my life.
Same here, all around because of the military, hard to make good friendships and people that you like, and we've connected. And one of the things I love about Ann is that not only is she in healthcare, but she deeply and honestly, sincerely cares about her patients' well-being and care. One of the things I noticed when I went to her is her time. She took it. She took her time to talk to me, and she sat down and treated it almost as a friendly visit rather than a medical process. And for the first time in a long time, I felt heard.
And Ena, I've known her since she was college counselor to successful real estate agent. And I have to say that I haven't noticed anything that she doesn't do well at when she attempts to do it.
Thank you.
Whether it was, being a counselor and then now into real estate, or her hobbies, which she loves soap making, and she's amazing at it, by the way.
Thank you. By the way, thank you for bringing up the soaps. You will be able to find some of my soaps at Ann's shop and clinic, I should say, because it's a beautiful clinic too.
Yeah, I do carry some there because it kind of goes with the theme of wellness, and she uses natural products and essential oils. So
that's right.
Love to use those guys.
Ann also helps me with my vanity.
We all have a little bit, right?
A little bit. So
some more than others.
Yeah, she does my micro needling,
so and collagen stimulating therapy.
And when I do have those procedures done, soon after that, people are always complimenting my skin, and I'm due for another visit.
Yeah, I got it set out. You should come by this Friday. You're having a gals microneedling session. So.
Ooh, sounds like fun. All right, so let's get to the nitty gritty. Today, we want to talk to you about our healthcare system.
Yeah, so Ena and I often we go to lunches a lot with each other, or we sit down and kind of start to, shoot the breeze, and we come up with these topics,
Yes.
And it seems like we have a lot to say about it. And kind of looking out there, I think people have similar experiences, and one of them that we had mentioned was why people are searching outside of traditional medicine for health, or to address their chronic symptoms or their problems. And I think initially posed to her, why do you think that is?
Well, you know what? That's a very, I think, deep and complex question. All I can say is that I become more and more disillusioned and disappointed with our healthcare. And don't get me wrong, we have pretty good healthcare, right? However, it takes weeks and weeks, sometimes months, just to get an appointment. And after that initial appointment, then it's another few weeks to get a referral. And then it's just ongoing. And there are certain situations that need attention immediately. In fact, not too long ago, I had a situation, and I wasn't given the right medication or advice.
Wasn't given medication at all.
Right.
Actually.
I wasn't given the medication at all. And I talked to Ann because I knew better by this time. One of the things I'm learning from you, Ann, is to learn to advocate for my own health. What a concept.
Yeah, I'd like to kind of disagree with you saying we have good health care.
Okay.
I think, yes, our country is state of the art.
Okay.
In terms of what we can accomplish. But where we lack is in access, provider shortage, as well as we are a commercial system. Healthcare is privatized in our country. So it's very much based on profit, right?
Okay.
And so when things are based on profit, at times, it's all about how many people you can see, versus it's more of a quantity versus quality scenario, I would say. Because I'm sure we've all experienced it,
Right.
going to the doctor and maybe having your 10-minute appointment with them that is usually rushed beyond, or because they're running from behind and they're
Right.
trying to see 30 people a day. So I really think we just do not have the time in traditional medicine to dig into who that person is, build that rapport, and what are those root causes pertaining to their complaints.
That reminds me, when we were stationed in Germany, I went to see a lot of German doctors there, and that was a huge difference. It was so refreshing to have the doctor come and greet me in the waiting room, invite me back to their office, sitting down with me at a desk and having a conversation. And this one particular doctor asked me about my entire family history, and he wrote notes. And it wasn't until after about 45 minutes talking with him that he said, okay, let's examine you. I thought that was amazing. And that's what I experienced with Ann in her clinic.
Yeah, like amazing for you because it's something you hadn't experienced,
Right.
in the States in our system. And I think those people are searching for that, and that's why they're seeking alternative medicine or a non-traditional clinic practice, like a cash-based clinic. I'm willing to pay out of pocket just to get that type of attention. And unfortunately, it kind of boils down to that in terms of being able to get that kind of care.
Right.
Because otherwise, in traditional medicine under insurance base, you have a lot of overhead,
Right.
that practices have to cover, and that means, how many people can I see in that day, versus not focusing on insurance reimbursement and a whole staff behind you to make those claims to be able to be paid for those charts that you submit to claim to insurance, is where you get the benefit of being able to have that time to talk to people.
Right. And also, one of the things that we have here on our notes is that due to the lack of conversation or wanting to know more about the patient, the system is failing to get to the root cause of whatever condition or symptoms one is having.
Right. It's just our current system focuses on putting a Band-Aid on things, right? You have the disease now. Now I'm going to go ahead and treat you and treat the symptoms with a pill that will, cover up that symptom, but not necessarily hit the etiology, reverse the process.
Right.
We're just all about here's your pill for that. Here's your pill for the side effects of that pill.
Right.
Instead of catching things early, or focusing on chronic disease, say diabetes, and rather than just say treat with metformin or insulin, really focus on that lifestyle and proper meds or supplements to reverse that process and come off those medications.
Okay. What would you've told me several times, Ena, you need to advocate for your own health. What would you tell the folk out there in the community? How can they be heard?
Yeah, so I think, oftentimes we leave the provider's office feeling frustrated because we don't feel that we were heard. Sometimes I feel it's a two-way communication issue. And a general person maybe not knowing what to ask, or afraid to ask, or not feeling like they'll have the time to ask. And so educating yourself for sure prior to an appointment, or if you have specific items that you want to discuss with the provider,
Right.
doing a quick Google search, even though we always say, oh, did you go to Google Doctor?
Right.
But it gives you that idea of, what should I be concerned about, or what type of questions should I ask, or what kind of testing am I looking for? And if you don't feel like things have been accomplished, then you need to speak up and say, I still don't understand what direction we're taking, or we didn't even address this scenario. Because, as providers, we're not mind readers.
Right. Okay. Right? Good point.
So you do have to not be afraid to kind of speak your mind when things don't seem to be going the way you want them to be going.
Well, see, now that I know that, right, it's so funny because you'd think that would come instinctively or intuitively, but it didn't. And I think a lot of us see the medical profession folk out there as higher. They are in a power of authority, so we respect that. And a lot of us have been raised to not question, those people in a position of authority. However, Ann makes a really good point. Now we have so many resources at our fingertips that we can Google search certain symptoms. You can look up, for example, medical journals on an online library to find out more about a certain condition if that's what's going on. So you can read more about what's happening, and then by doing so, then we can formulate the questions that we want to ask our physician. And what I found myself doing last time I had to go through a surgery, I took my notepad and pen, and I already had written down the questions that I wanted to ask. And during those, when the doctor was explaining to me the procedure, I had to slow him down. And I said, wait a minute, can you say that again? And I wrote things down, and I asked for the paperwork so I could go home and research that procedure. And I felt much better knowing what the doctor was talking about.
Yeah, I've noticed in listening to other individuals and not necessarily being their primary care, just kind of a consultant in a way, or hearing a piece of what they've been dealing with, is that often they are very confused about their health care and why they're on certain medications, and you can tell that no one is really taking the time to provide that education, and we've tried, I think, to shift to more of the shared decision making way of doing things.
Okay.
I don't think it has been integrated very well into traditional medicine because of the time crunch and the shortage in staff, providers. But you're supposed to kind of sit there and educate each other, know about that person. The provider can then guide you or provide you with the education for you to help make the decision on your care, right?
That's right. That's another thing, too, is that ultimately, I mean, we want to hear what the doctor says. They have the education. But it is our decision because it's our body, it's our health. So it's good to make informed decisions.
Well, and I have to say, even as a trained nurse practitioner, I get frustrated when I access healthcare. I almost try to avoid it at all costs unless I absolutely need to utilize it, which is sad, right?
Right.
So even I going in knowing how it should go and what I should be asking, I still feel that hesitation to engage with my provider. I mean, for example, I had an appointment yesterday, just like, an annual checkup, right? I haven't been in for a while. I'm 41. I need some labs done.
You look fabulous, Anna.
I know. And so for some reason on my calendar, and anyone will know this about me, I'm very chaotic. I'm a very chaotic individual, but I had 8:45 for my appointment, and I didn't have a text reminder or anything, which they usually send out, right? And so I was there, luckily, at 8:05, because apparently it was at 8 o'clock.
Oh, okay.
They usually give you that 15-minute grace period or so. But from the onset, you can tell that they were irritated that I was not there on time, and that they're already posing, questions. You can only have one complaint now, but she will still see you, even though you've met that grace period. And so they're already setting the stage for me not really to want to dive into things, because I can tell that they're rushed, that they're in a hurry, that they probably aren't going to listen to anything I want to say. Because I wanted to mention I was having some gallbladder issues, I thought. Not so much stones, but something chronic. But I just ended up saying, hey, I need some labs and renew my referral. Because I could just, the mood was not there. So even even us who are trained in the system, don't necessarily love the system. And we can definitely see the deficiencies in it.
Wow.
Yeah.
Okay. Well, I think we can wrap up, or what do you think?
I think that's a good start.
I think this is great.
We have lots of things that we decided we want to talk about.
A lot.
A lot. So tune in, and hopefully it kind of strikes a chord with you guys. And we love to hear, comments, or if you have topics that you're just dying to hash out or have someone talk about, we would love to incorporate that into what we're doing here.
Absolutely. Thank you so much for being here, and we will talk to you soon.
Have a good day.
Bye.
Or could say, in good health.